You're listening to Staying in the Game, a Plum Dragon Herbs podcast where we have conversations about mindset and techniques for staying at the top of your game.
Welcome to our show, Dan Dominguez. We're really excited to have you here. And I'm just wondering if you could briefly introduce yourself to our guest today.
Hi, thank you for having me, Janelle. My name is Dan Dominguez. I'm a sports-oriented acupuncturist in Buffalo, New York. My background is in exercise science and strength and conditioning. I was a college football player who unfortunately suffered some injuries late in my career that kind of shifted my mindset on health and wellness, and I was introduced to acupuncture that way. So I have a integrative practice here in Buffalo with sports massage, sports chiropractic, and another acupuncturist. And so we service the Buffalo area, and I'm also the team acupuncturist for the Buffalo Bills.
Okay, yeah, that is so exciting. And I'm sure that it's exciting for you because with your background in sports as well, to be able to work with the Buffalo Bills.
Yeah, it was a dream of mine when I set out my goals, 8 years ago when I graduated. I wanted to do a few things, and the one at the top was definitely to work with professional athletes, and primarily my sport, which was I played college football. As I didn't make it as an athlete, I'm very happy to have made it on the health and wellness side for these guys, and being able to feel like I'm a part of the game on Sunday is huge for me.
Oh, that is so cool. So tell me, what exactly happened? You broke your leg when you were playing college football?
Yeah, so my senior year of college, during fall camp, so it was August 9th of 2009, I was running to catch a pass, and in the back of the end zone, there was a metal wagon. So it's right on the back end line, and the quarterback overthrew me in the end zone. And as I went to catch the pass, I'm running full speed looking back. I hit this wagon and shattered my tibia and fibula. So it was a compound fracture, career-ending injury on the spot. So as I came out of my surgery, my doctor, he was like, we're going to try to save your leg. We're going to try to have you walk without a limp, but it's very unlikely that you play football again. And he was right. It was a career-ending injury, and through that process, I ended up having 7 surgeries due to infections and just hardware replacements. So I have a rod in my tibia and 2 screws in my ankle, and they had to skin graft the leg shut because it was too swollen to close on impact, just due to the trauma that I sustained. So as I was recovering from that injury,
that's so devastating. Oh my goodness.
Yeah, it was. You wake up that morning, and I'm a college athlete who, I felt like I had really elite athleticism, and then the next day it's gone, and so that was tough as a 21-year-old to face that and face that adversity. But I always tell people, when I tell them the story, that the best thing that ever happened to me was breaking my leg, because it allowed me to find my passion, which is Chinese medicine, and particular acupuncture. And so I look at it with a grain of salt and look at it like it was a blessing in disguise. At the moment, I was devastated. But when I look back on it, it started me on this journey towards health and wellness that I'm on now. My uncle, his name's Rick Warren. He is an acupuncturist in Rochester, New York. And he treated me after I broke my leg, probably about 3 months after. So it was after my last surgery. I still had a ton of swelling in my leg. I was unable to walk without a limp. I couldn't toe raise. I couldn't get onto my toes. I just had a lot of weakness there. And it was right around this time, about 10 years ago. And I remember getting my first treatment, and it was like I had this disconnect from my leg. Like all of a sudden, nothing hurt. There was no pain that I felt in my brain. It was like it just didn't exist. You could have cut my leg off. That's what it felt like. And he treated me a couple times that weekend. by the end of the weekend, I was walking normal. I was able to get up on my toes, get up on my heels. Like I had strength back in my leg, and the swelling was significantly decreased. So he actually taught me how to needle myself, sent me back to school with a box of needles and Sharpie marks all over my leg. And he gave me Chinese herbs and supplements to take. And he said, do this every day, and you're, as much as you can, and you will heal, and you will heal fast. And I mean, it was a turning point in my healing. And I really started to progress again. So much so that I actually went in for a checkup with my doctor 1 month later, and he slapped up my x-rays, and he thought that there was an immense amount of healing that occurred in 1 month that he normally doesn't see. And he actually asked me, are you taking HGH? And I was like, no, I mean, I'm just getting acupuncture and taking some Chinese herbs. And he totally kind of laughed me out of the room. And he was like, it's not that, and he was like, you should stop taking that HGH. It's not good for you.
Oh my gosh.
Because it was that profound of healing. And it's not something that I can reproduce in clinic, because you don't get a chance to treat someone as often as I was treating myself. But it showed me the power of this medicine. And, as an athlete, to be able to help other athletes that are in pain and help them get back to their goals. I saw it right then in that office. Like, I was like, he just has no idea, it's limited. Like his mindset is, he just thinks linearly. And that's when I decided I was going to go to acupuncture school. And a funny story is, years later, I started the acupuncture program for the University of Rochester, their sports medicine department. And I had a medical doctor come in and shadow me. He was from my school, and it was a new team doctor. And he was like, yeah, we want to integrate acupuncture into our physical therapy for our athletes. And, I was referred to come see you specifically. And I was like, it was a funny story. I was like, it's funny that the old team doc, wanted nothing to do with this. And I actually went to that school, and it was just such a small world that he ended up coming to learn from me on how to integrate that into their sports medicine department. So it was a cool moment for me, and justification that I made the right choice.
Yeah, that's really, really cool.
It was a new doctor. So I think, just like anything, people progress, there's more innovative thinkers coming behind the old guard. And a lot of Western medicine doctors can be stuck in old ways. Sometimes good, sometimes not. I believe that within the sports medicine world, acupuncture was much less used 10 years ago. As opposed to now. I think it's really gaining a lot of popularity, and that's obvious. The fact that I'm even working in the NFL kind of shows how the medicine has progressed over the last 10 years.
Right. Yeah, absolutely. It's really fun to see that. So let me go back a minute. When your Uncle Rick told you that he could help you, did he approach you, or did you approach him initially?
He approached me. He called me, to check in on me, and he was like, "Dan, I'm coming home for Thanksgiving. We're from Columbus, Ohio, and he was in Rochester, New York. I was in Saginaw, Michigan, and we finally got to get together. And I had seen acupuncture my whole life. As a kid, whenever he would come home, he would hold court in my grandma's house, and it would be a conveyor belt of family members coming in and out of the guest bedrooms, and he was treating them. And when I graduated from acupuncture school, he passed the torch to me. He was like, I'm finally going to take a vacation when it's our vacation. So I now have the duty of treating the family, and he gets the day off.
That's good. That's good.
I'm happy to do it. Yeah. So maybe one day there'll be another one of us in the line of the family that could take over for me.
Yeah.
But he's been practicing for probably 33 to 35 years now. So he's, well versed in Chinese medicine.
So when he approached you, you weren't like, "Oh, thanks, Uncle Rick," but no thanks. Like, you had already been exposed to it and were open to.
Oh yeah, treatments. I was excited. I was excited to try it. I wanted anything that would help. Really, for me, I was in a lot of pain and frustrated, and he offered something that I didn't know if it would work or not, but I was willing to try it, and I was lucky. It did. It made significant difference for me immediately. So much so that, I mean, it really like fascinated me, and I was hooked after that. I was like, I'll do whatever you say, because that felt so good. And I would call him and say, hey, I've got this going on. We would FaceTime, and he was like, all right, put the needle here or here. And he really kind of walked me through it over the phone, which is it's crazy. And he doesn't do it for any. I just happened to be his nephew, so he did it for me.
Yeah. Well, that is really cool how that led you to study, exercise science and Oriental medicine and acupuncture yourself. Were you already studying exercise science at the time?
Yes. So this happened my senior year in college, the injury, and I was just finishing up my undergrad degree in exercise science. I was actually on my way to get my master's at the University of Tennessee. I was going to be a part of their strength conditioning program and be a graduate assistant for them when all this happened. So it kind of made me change gears, and I decided to go to acupuncture school instead.
Okay. Yeah. So when you were going to the acupuncture and Oriental medicine school, how were you feeling, like, emotionally? Were you still devastated about losing your out on the rest of your football career? Did any Oriental medicine mindset philosophies help get you through that, or where were you at, like, emotionally at that point?
I was excited about this new challenge, but I also still had a lot of sadness at the way things happen, and just frustration with the system as a whole, and having to have surgery over and over again, trying to get it right and not having that completely answered. And I was still kind of recovering at that point. It took me probably about 1.5 years to fully just feel like I've never felt like I did the day before I broke it, but to get to a point where I was back to working out the way I wanted to and doing things like that. But so yes, it was a mixed bag for me, but I was excited for the challenge and excited about this medicine. So I think it was a little bit of like still looking back over my shoulder at what was, but also like kind of excited to see what was coming next. And it really kind of hits you once you start having success in clinic, and I kept helping people, and this stuff was really working for them. When you're in school, you hear it's going to work. Like this, if you do this, it'll help someone. If you do that, it'll help someone. But it's not really until you're in clinic, seeing patients and seeing this stuff really help people, that it gives you an appreciation for the last 3.5 years of schooling you just went through.
Mm-hmm. Yeah, I'm sure it was so fulfilling to be able to see, your clients and patients to recover from their injuries. So tell me, when you were first starting out, like, what were some of the stories that got you excited?
Well, early on in practice, you're just really trying to figure out what it is that works, what doesn't work. And what I found, you graduate from acupuncture school with a degree in traditional Chinese medicine. And I was seeing a ton of pain in my clinic. That was probably the primary thing that I saw. It was a little bit mixed bag back then. I would see a lot of allergies, a lot of just general stress and depression, some fertility work actually. But if some of my friends listening heard me talk about fertility work, they'd laugh, because I've become such a specialist of sports medicine that now if someone comes to me with a complaint like that, I just refer them right out. I said, there's a better acupuncturist in the world for that kind of case. If you're here for like orthopedics or sports medicine, you're in the right clinic. If you're not, let me send you to someone who is more well versed in that. But early on, it was just you're like you're good at everything, but you're not great at anything. So and that's kind of where I found my direction. I always knew I wanted to go more sports medicine, but it was finding the right teachers, finding the right people to further my education. And so I did a lot of learning after I graduated, and I studied from some really great acupuncturists. One of them, his name is Rich Hazel, and he's since joined my practice here in Buffalo. But he was the one that introduced me to motor point acupuncture, which is magic. If anyone listening has never had electrical stem on needles, it does things that nothing else can do when it comes to pain and activation of muscles. So once I was introduced to that, it was like opening a whole new book for me in the world of needling and acupuncture, and I just dove straight in. And I really went from being more traditional Chinese medicine to strictly orthopedic as soon as I took his first class.
Mm-hmm. How often does somebody with a sports injury typically need to be seen to see results in acupuncture?
In traditional Chinese medicine, or another style that is called distal acupuncture, where they're using points not in the local area of pain, you're looking at 6 to 12 visits, to get what you want out of that. In these orthopedic style acupuncture treatments, sports medicine style acupuncture, it can be as soon as one treatment.
Wow.
And, my typical patient is only in my care from somewhere between 1 and 6 treatments before we discharge them.
Oh, wow.
So you get results very fast. And that is what fascinated me, was how quickly you could change somebody's pain or change somebody's function when you added electricity to the needle. And or use the needle to break up trigger points. Those are big game changers for me, and things that really grew my practice very fast. Because when you can treat somebody once and they feel instantaneous improvement in strength and function, they'll listen when you say, "Hey, I need to see you this many more times." And of course, the more chronic a condition is, the longer it takes to fully fix all the layers of dysfunction that have been created. But even then, I've seen there more times than not, you're having a miraculous outcome with treatment with this style of acupuncture.
Mm-hmm. That is really incredible. So tell me, what are some of the other types of modalities that you use in your practice that are, I guess, cutting edge or innovative that aren't in every typical acupuncturist practice?
Well, I think the big one we kind of alluded to is this style called neurofunctional acupuncture, and it is the use of electrical stimulation and motor nerves. So you needle motor nerves and use electricity through the needle to elicit a twitch response, and that retrains the muscle via the sinovertebrae nerves to stimulate activation of that muscle. One of the hardest things for people to do when they're injured is to activate muscles. So if you have a torn ACL, for example, I see a lot of torn ACLs. They spend the first 10 weeks trying to get your vastus medialis obliquus to fire again. It's called your VMO. And they'll use padded stem on there, and they'll try to get the muscle to fire with stem and exercise. But it's very hard to get that to occur. But when you put a needle in, the needle effect with electricity, it takes it right down to the motor nerve. You can touch the nerve and stimulate the muscle from the inside out. And that has a much longer, broader effect in that tissue in creating that fire cycle again, and getting things to contract the way we need them to, so they can get stability back and get range of motion back faster in their knee. And, it's all about, on a timeline like an ACL, getting someone from an 8-month recovery to a 6-month recovery. And
wow.
that can be done, if you have the right treatment at the right time.
Mm-hmm. So, you're saying that sometimes it only takes one treatment. What do your patients need to do after they see you to make sure that it sticks or that they don't re-injure? What are some of the pieces of advice that you're going to give them to continue their recovery?
Depending on the injury, we put every patient through an assessment. So I put them through a movement screen, and I muscle test everyone to see what's not firing well in their system. If they have back pain, I'm looking at the hip and the core primarily. So research shows that anyone that has lower back pain has inhibition of the internal oblique and transverse abdominis. Those muscles are kind of like light switches for the body. They have to fire first, and if they're not firing, then that puts strain into the paraspinal muscles and the QL in the back, and they start to overuse those muscles, and it also shuts off as a cascade effect to then shut off the glutes. Now, if your glutes aren't firing, that's the biggest, strongest muscle in your body, then you're in trouble, and you're going to rely on your hamstring more and your low back more, and you end up with tightness in these areas that you just can't seem to get rid of, no matter who massages it or no matter who, scrapes it. But once you get the core firing again, it turns the light switch back on. Then you can change the bulbs, which are the glutes and the hips and the lower back, and get those firing again. And if you turn on the glutes, then the lower back doesn't have to work as hard. So it's a combination of things. So once I do that, once I figure out, all right, what's not working well, we treat it, turn those muscles back on, release whatever tightness has occurred in their body, maybe trigger points or such. And then I give them exercises. And that comes back to my background in exercise science and strength conditioning. So I'll give them various activation cues and exercises to do over the next week or two until I see them again. And once you make a muscle fire on the table with the electric stem, it's much easier to use it in real life and get it to happen when you're doing your rehab. So what we found when I was with the U of R is once a patient had acupuncture, we would send them right into physical therapy, and they would see immense change. The physical therapist would see immense change in their ability to do the exercises without pain and get the right activation, the right muscle to fire at the right moment. And they were able to progress them much faster that way. So I quickly became they really utilized me for pre-physical therapy activation. So they would send their patient, all right, I want you to see Dan before you see me. And they would walk right into rehab, which was really great. That was a great model that we kind of developed there, which I eventually want to have in my private practice, is to have rehab right on site so they can go right into a physical therapy session right after acupuncture.
Okay.
So
yeah.
usually, as far as the same day treatment, I'll send them home, with liniment. I'll tell them to use heat over top of the liniment and or do an Epsom salt soak that night. I really like magnesium in the Epsom salt. I think it helps clear lactic acid and kind of warm the area and get things moving. It's all about blood flow. At the end of the day, acupuncture, gua sha, liniment, it's all geared towards bringing blood to the area and pushing out stagnation. And that's what we're trying to do.
That's so great. And you mentioned liniment. What types of liniment do you like to use? I know that we just recently gave you a sample of our
just
products.
Introduced to yours. So I'm excited. I'm excited about that. I've been using it on some patients, and I've loved it so far. I'm waiting to get some feedback from some of the people I saw last week when it arrived. But my old tried and true, the liniment that I've used for years, that my uncle introduced me to, my favorite one is called Posamon. I like the consistency of it. It's more oily in nature. So I'll use that quite often when I'm going to do cupping or scraping, because it'll help, like, I can glide. It acts as an oil base versus some of the other liniments that I've used from a company called Camwo in the past. I like their tendon liniment and their bone liniment for different conditions. And I'll put that right on with heat over top during treatment. So I'm a big fan of adding heat into treatment. I find that just helps warm areas that maybe in Chinese medicine, injuries get defined as you can have blood stasis, which is things are stuck there. There's inflammation in the area, so things aren't moving smoothly. Think of it like a bruise. Everything gets stuck there, so that's blood stagnation. And sometimes the bruise goes away, but the underlying tissue is still like that. So there's Chinese herbs that work great for moving blood through that stuck, thickened area. And then, injuries can be defined as when cold bee syndrome, which is like someone gets injured on a wet, cold day, and that's the person that needs to like move to Arizona to make their arthritis feel better. They just don't do well in the Northeast in the winter. Their condition gets worse. So then you want more warming herbs to help warm that area, like the knee, for example. It's like so many people come in and say, oh, as soon as it gets cold and damp out, my arthritis just kicks up. And so then, I like to use liniments that are warm in nature for that. And Posamon's more, I would consider that to be more of a neutral formula. It has warming and cooling, but it's not one way or the other. It's kind of like a do-it-all kind of Swiss Army knife.
That might be a little bit like our ancestors' advanced formula, which is good for arthritic complaints, and also like martial artists, a lot of times who do iron palm training will use it because it does have like a combination of some warm and cooling herbs in it. So
yeah, so it's like that's like your Swiss Army knife then.
Yeah.
Okay. Which those Dit Da Jows are so strong, potent stuff.
Yes. Yeah. The other one that we sent you, our bruise juice, it's good. It has good cooling herbs. It's an anti-inflammatory product. And then the third one is Ho Family, which is actually more of like our all-around, all-purpose pain, nerve pain, muscle pain, any kind of aches and pains. It's more, you might feel more of a response to that immediately. So, yeah. So that's kind of our all-around one. I wanted to switch gears for a second and talk to you about prevention. So you're working with the Buffalo Bills. Do you do things like conditioning wise in your practice?
So when I'm with the team, everyone kind of has a role. They have strength conditioning coaches, they have physical therapists, they have athletic trainers, they have massage, they get access to amazing practitioners of each individual field. So when I'm with the team, my role is to do acupuncture for them, and I kind of stay in that lane. When they see me privately, I give them different advice for sure, but when I'm there with the team, I'm there to do their acupuncture. And many of the players utilize it. You'd be surprised at how many guys get treatment twice a week. I'm in there with the team on Tuesdays and Fridays. So a typical game is played on Sunday. Sometimes it's a random Thursday or Monday night. But I like to get in. I'm in there early in the week so that I can treat acute injuries, ankle sprains, things like that. And then what we've really developed is a Friday protocol for players where we do a lot of, even if, they feel pretty good going into, by Friday, most of the players, it's like after a game on Sunday, you feel like you got in a car accident till about Wednesday. And then, you can practice again on Thursday, and then Friday, you're like, all right, I could potentially play in a game again. And by Sunday, you're finally ready. It's like this cyclical kind of just, I hurt. Okay, I'm ready to play. And so acupuncture is used as an adjunct to help those guys, recover faster. But Fridays are a big activation day, and that's kind of what as far as prevention, soft tissue injuries are 100% preventable. That's one of the areas where we've seen a lot of hamstring pulls, pec tears. Anytime you get a soft tissue injury, that's something that occurred either because for a couple different reasons. Either you're not sleeping enough, you're not eating the right things, there's excess stress in your life, so it's creating inflammatory markers, or you're not recovering with the right things. You're not taking care of your body. So when someone gets a hamstring pull, one of the first things we look at is how's their activation in their glutes. If they're not utilizing their glutes properly, they're going to pull from another muscle and then overwork it and eventually pull it. And the same with non-contact injuries like ACL tears. If you see somebody running down the field and they go to plant and they tear their ACL, that was happening in their system long before they actually tore their ACL. Things were shutting off. So if we can keep the right muscles strong, the glutes being the key to all power in the body, then guys are much less likely to have soft tissue injuries in games. And, those football is one of those sports where you can't really prevent all injuries because you never know when someone's going to roll on your ankle or tackle you at a weird angle and your knee, buckles. That's playing the game. But to run down the field and pull a muscle, that's preventable with treatment. So a lot of the guys have bought into that. And I'll see 20 to 25 guys on a Friday to get their bodies ready for the game.
Mm-hmm. That's so great. I bet they love it. With all of your patients that you see, what is like some overall advice that you give them so that they are like staying as healthy as possible? You already kind of mentioned some things like getting enough sleep, trying to eliminate some of the stress in their life.
Well, I think it's different per person, but you can't talk to an acupuncturist without hearing a Chinese proverb. And my favorite Chinese proverb is don't start digging the well when you're already thirsty. I think too many people wait until they're injured or wait until they're sick, and they get reactive instead of proactive with their health. And I heard a quote a long time ago that resonated with me, and it says, "You're either going to pay for it now or you're going to pay for it later." And it's a lot cheaper when you pay for it now in preventative medicine. And if you're gonna be active and you want to be active for a living, like in martial arts, for example, I see so many chronic overuse injuries from kicking, a lot of hip problems later on, groin problems, stuff that lingers for years and they don't address it. And I think if you want to be an athlete, even a weekend warrior into your 40s and 50s, the things that you do in your 20s and 30s will greatly benefit you. Stretching daily, getting 8 hours of sleep, drinking enough water, all those things. You don't have to pay someone to get enough sleep. That's something you can choose to do and shut your phone off. But when people come in and they have like 3 or 4 injuries, then we start looking at, okay, what's going on with your gut? There's systemic inflammation here. You shouldn't have injuries all over. Mm-hmm. So if you do, then we start looking at your diet and your sleep and your stress, because those are all reasons why you end up getting lingering chronic pain. And so once you address those, the body can recover better and have a chance to heal. But when someone walks in and they're, say, I have lower back pain, and then we start going through their history and they have diabetes and they're sleeping 4 hours and they're stressed at work, I'm like, your body is not concerned with your back pain. It's trying to stay alive. You're in fight or flight mode all the time.
Right.
So you can't ignore that and just say, oh, I have pain, fix this, when your body needs so much more. So that's when we start having conversations about, lifestyle and starting to change the things that you control, right? Doing some meditation, making it a dedicated effort to sleep more and stress less, which is easier said than done, but those are truly things that cause pain in the body. So you have to treat them. You treat your body well.
Yeah, that advice is really priceless, and I'm sure it's helped a lot of the athletes that you've worked on over the years, so that they can perform their very best.
And that is the thing. It just because they're a professional athlete doesn't mean that they don't have life things going on, and those little things can be the cause of an injury or be the reason why they're not recovering like they should. But one of the other things I see in a sport like CrossFit is overtraining, where you start to hit a plateau in your training, and instead of taking a break, a week off, or doing what's called a deload week, they double down and they train harder and they do 2-a-days, and then their body just starts to break down and they show up in the clinic with all like tendonitis in the knees and elbows and shoulders. And then when I get down, I'm like, what's your regimen like? What's your recovery like? These people are a mess, and they're not taking time to recover. It's just as important as the workout itself is the recovery. And so, then we start to just retrain their mind on not needing to work out 7 days a week, letting your body absorb what just happened over the last week in training and take that in and the benefits of it, and kind of give yourself a chance to look back on it versus pushing to the next day and the next day and the next day.
Mm-hmm. Yeah, that must be so difficult when you're talking about competitive sports. They just want to probably keep pushing themselves to the limit as much as they can.
Well, you look at it in pro sports, there's always an off season. So they have time to recover. They have time to take off and get their bodies right. And in football, the season is August to, if you make it to the Super Bowl, February. And then you get about 2 months off. Then you come back for a little bit in the spring. Then you get another month and a half to 2 months off before August. So they have plenty of time to recover from the wear and tear of the season. But it's more like general population, like CrossFitters and triathletes and marathon runners. They're the ones that don't have off seasons. They don't know how to stop. So they end up with most of the overtraining injuries. The pro athletes are much better on their schedule. But you look at that in almost every other sport other than CrossFit and running, do people actually take breaks, but in those sports they just keep pushing, and they are their job security. They will be coming in forever until they learn their lesson.
Now tell me, you've done a lot of training and workshops and clinics and things. Are you mostly training other acupuncturists how to do the same things you're doing, or are you just doing workshops for athletes so that they know what they need to do to take care of themselves and what your treatments can do for them?
Most of my workshops are teaching other acupuncturists the style of acupuncture that we do. It's not taught in school. Neurofunctional acupuncture is really, it's advanced techniques within the acupuncture world. And basically you're graduating with 3.5 years on traditional Chinese medicine. And you really, if you decide to go the sports medicine route, you would seek out a couple different teachers in this realm. And I think because of the work that I do in the professional sports, I've been sought out more often to teach what I'm doing on these athletes. But for the most part, I'm holding workshops for other acupuncturists. Okay.
And have you been able to continue doing that? Do you do it virtually, or are you still holding workshops?
I'm not currently holding workshops during football season. I'm pretty tied up with the team in my private clinic. So I don't do much teaching this time of the year. And COVID's really put a stop to a lot of the seminars that we had scheduled in the last year. So we're kind of on hold. We tentatively are going to Australia. And when I say we, I mean Rich Hazel and I are going to try to get out to Brisbane and Melbourne next year and teach there. We want to get out to Amsterdam again. We've been there a couple times, but we tend to hold classes out in Amsterdam, and we'd love to have a couple here in Buffalo. As long as we're allowed to have people in and out of the state, eventually. Right now, New York's on lockdown, so we're not doing much of that.
Yeah. Well, it's sure been a privilege to be able to speak with you and for you to give us insights into neurofunctional acupuncture and the work that you do, which is completely amazing.
I appreciate that. Yeah, and if anybody's interested in learning more about this technique, my Instagram is BOSA 716, and my website is www.bosa716.com. And feel free to reach out. My direct message me if you're listening to this and you need to find a practitioner in your area that does. If you're interested in trying that, I can try to help connect you with someone who does that. And I just think more people need to have good acupuncture, and they'll feel a lot better.
And it's great. I'm excited to bring more awareness to this about how it can help so many people with their sports injuries. And we will also post those links to your Instagram and your website on our show notes page. And we will at plumdragonherbs.com. So we can also direct our listeners to you via that way as well.
Well, thank you.
Yeah. Well, we'll let you get back to your life. And I guess you're probably done for the day, but I know you're really busy with clinic.
I'm done with clinic.
Yeah.
But I'm going to go hang out with my miniature dachshund now. So
that's so great.
We're just gonna chill for the night.
Yeah, I was my own little dog thinks he's pretty tough stuff. He was making a little bit of noise. So, anyways, thank you so much. We look forward to
It was a pleasure chatting today.
Posting this and hopefully helping other people to address their injuries in a new and exciting way.
All right. Hey, have a great night.
Okay, you too. Take care.
And thank you to all of our listeners for joining us today. Be sure to visit us at plumdragonherbs.com for show notes, a transcript, and links to things we discussed today. Also, if you could just take a moment to hit the subscribe button, you'll be helping us spread the reach of this podcast to others who could really benefit from it. Our guests have amazing things to say on staying in the game.